AM 1220 KHTS, your hometown station. I'm Kyle Jennings. Appreciate you hanging out with us for the Providence Holy Cross Hour on your hometown station. Also streaming live at hometownstation.com. You can also download the free KHTS app on your iPhone or Android devices. And learn more about Providence. Go to providence.org/holycross. And we're talking with Associate Administrator Heidi Lenartz. She gave us a little background on her, actually, specifically, and then also telemedicine and telecommunications, telehealth rather. And it's a fuse went off in my brain, and things are blowing my mind at the moment. This is Heidi. She, again, Associate Administrator of Providence Holy Cross, providence.org/holycross. But let's talk a little bit more about some of the programs that Providence is working on with telehealth and telemedicine.
Yeah, so I'd like to talk a little bit about the telestroke program that we have, and this is literally a robot of sorts, or a platform of sorts, that enables a neurologist to be off-site or remote 24 hours a day, 7 days a week, and available for our emergency room, and available via the platform, let's say a video monitor. And so the platform has a video monitor. It can be moved and relocated within the emergency department. So if a patient is brought in through the ER or to the ER and has an acute stroke, or we suspect there's an acute stroke occurring, the neurologist is contacted to patch in, is accessed, can logs on immediately within minutes or a minute, and can visualize through the monitor at his end or her end and the patient's end any signs and symptoms, can assess the patient through verbal, physical, visualization of the patient in the bed, in the room, wherever they're standing or sitting or lying. So they can assess pupil dilation, they can assess motor responses, they can interact with the patient and determine, just as they would if they were standing in the room. They can, with a caregiver at the bedside, typically a nurse, they can actually go through a full assessment of the patient and begin any orders immediately that the person might need to intervene with a stroke situation. So we call this our telestroke program. This person is in the hospital,
emergency room.
In the emergency room, and the doctor, the neurologist, has their vital signs, like we talked about earlier. They access the vital signs through the robot, and those readings are come up for the physician at their remote location, whether that's their office or their home. And they're immediately assessing the patient with the nurse at the bedside and with the ED physician at the bedside, and then determining interventional steps and treatments immediately. And there's so no delay in care at all. Is there like a webcam? It has to be like a webcam hooked up, right? Or is it something else? It has to be, right? Prior we've evolved from literally a robot standing in the room on that can be remotely moved from one end of the room to the other. We've evolved a little bit from that, but at this point, it's a PC of sorts sitting on a cart with a high density monitor, and can really able to see the fine details, for example, of eyes. Well, that's what I was going to say. They can dial in very, very closely to your eyes and assess all features and skin color, muscle tone. I mean, they can ask the care provider at the bedside to assist the person making certain movements to determine their mental status, physical status. And it's exceptional when you see the demonstration. Do you so the demonstration? I was going to ask you, the doctors is there like a special training program happening for this? There is. There's a curriculum that they review, they sign off on as part of credentialing for this. But it is really no different than the credentialing. Really isn't any different, but they do practice and perform a competency around being able to access timely review and transmit images and communicate immediately with the ED physician.
Because I would think that you wouldn't want that to be your number one concern if your mouse isn't working or whatever.
No.
You want to be able to get in there, do it, and then tell them how to treat this person. So is this the only one? Is this the only type of the telestroke thing? Is that the only type of telehealth thing happening at Providence?
No, we saw the opportunity to really leverage and scale this to other services and specialties. So one of the other initiatives that we've implemented this year was the telepsychiatry service. So more and more of our emergency departments are impacted by visits of people with challenging mental health issues, and they need immediate assistance and intervention and counseling and assessment by a psychiatrist. And so we found that the best opportunity, because of the shortage of physicians, not just in psychiatry but in other specialties, but psychiatry in particular, we found that we could really access a group of psychiatrists to serve multiple ministries at the same time. And so we have psychiatrists on call, again, using the same platform and hardware, the visualizing the patient through the monitor. Within minutes, they can call in and visualize that person, talk with them, and assess that person for whether what medication they might need, what their social issue or mental health issue might be. And then we can work with the social worker and the case manager and the nurse and the ER to rally and mobilize some resources for that person, even if that means to go home and see their own physician, or if that means for further treatment and care in another facility. So it's transformative, really, because Los Angeles is so large, the demographics make it nearly impossible for number of psychiatrists who are available to really serve that many facilities. So telehealth and telemedicine in this case has really enabled better quality of care for this patient population and for most patient populations that need a timely response. We're finding that it reduces their wait time, and the distress of being in a situation where you're in an emergency room, you're waiting for care. Both telestroke and telepsychiatry really enable more rapid patient assessment, quality care, better satisfaction for patient and the other patients as well in the emergency department. So patient can be discharged, receive care more quickly, medications can be ordered. It's really been helpful for the care team as well.
Fantastic. And it's a cool, it's cool too. It's really cool. And it speeds up, like you said, waiting in the waiting room at the ER is stressful enough.
It can be.
And getting care that quickly can certainly help with that situation.
One of the other services we offer, we're looking to expand into, is actually for obstetrics, as people come in, as women come in for urgent issues to the ER or potentially emergent. Might we be serving our patients better if we can immediately obtain a consultation from an obstetrician for that woman? She's coming into the ER. Can we immediately have a physician, patch in and talk with her, meet with her, assess her for any further intervention immediately? So that's another opportunity we have.
We're speaking with the Associate Administrator Heidi Lenartz of Providence Holy Cross. This is the Providence Holy Cross Hour. Learn more at providence.org/Holy Cross. And I wanted to ask you, this has kind of been the theme of the whole thing, but how does telehealth, telemedicine integrate with hospital care?
Well, there's so much more opportunity. I think we're looking at a healthcare system that's more and more integrated, where you have physicians, nurses, clinical professionals, specialists, all part of the care team with each and every patient. So how do we integrate everybody at the same time in a timely manner? So telecommunications and telehealth and telemedicine enable that. Just an example of that might be home health. What I was talking about earlier, for people we send home, for example, they're stable in the hospital, they're going home. What if, and this is happening at this time, but what if, imagine if you will, if you haven't heard of this, you have your iPad at home and you can connect with a care team within 1 hour, 2 hours, 4 hours, or 6 hours of getting home. If you have questions about your care, your discharge orders, what if you can actually access someone from your care team or a care team, post-acute care team, to ask those questions? You know, some people have to call back, they check back. What if you could really get those answers? Or someone is reaching out to you to say, how's your medication going? What if you have a wireless weight scale at home that could transmit your weight, your blood pressure, your oxygen in your blood? What if all of those things were being transmitted to your physician's office? It's the opportunities are endless. So we're stepping into that arena with home health services at this time. That's another exciting opportunity that we see. In fact, today I was talking with one of the physicians from our Trinity Hospice program, and they're looking at how we can integrate this type of service with children in their children's program to better allow for more access for children in hospice to care providers who are part of their treatment team. It's such a strong bond between patients and their care providers at times. They really do become sometimes 24 hours.
Yeah, you know, the thoughts that are popping into my head is sometimes you hear complaints about doctors, you know, just spending 2 minutes with you, being on your way, and this kind of adds. And then another thing that popped in my brain was you were talking about if you have questions after you get back to the doctor. I feel like every time I go to the doctor, I have a list of 50 questions that I want to ask, and I ask, how are you? That's the only question I ask the doctor, right? And so this seems like a way for people to feel better because the communication is more open with doctors, and not only that, but doctors I know they care about their patients, but maybe they'll be able to have more information, so they'll be able to help them and care for them more.
Yeah, and you bring up a great point. Part of what's so transformative, too, is that it's not only physicians using this technology. Really, when we think about it, it expands the ability to contact what we might call physician extenders. So you could reach out to a nurse practitioner. A nurse, your care manager, case manager could be reaching out to you, clinical social worker, a variety of issues. All of these healthcare professionals, this is the whole team, can reach out to you and provide like an interprofessional care management, and that's so much more integrated than in some of the models that are more reactive, waiting for you to call, waiting for you to have a symptom. This sort of really gets into the preventive arena of how do we prevent you from having to come back to the hospital? That's really the goal. How do we keep you safe and stable at home? We got to keep the doors open, electricity on. We don't, it'd be better if people weren't coming to the emergency room, certainly. That's not our mission. Yeah, that's not the goal. Yeah, that's certainly not the goal. We're speaking with Heidi Lenart. She's the Associate Administrator over at Providence Holy Cross. You can go to providence.org/Holy Cross for more information. And I'm going to be at Providence soon. This one was planned. This is planned, though. My wife is having we're having our third child, and we're delivering in Providence. And so this is something that would be absolutely wonderful for somebody who just had a baby. Something like this, if they need to talk to a doctor about, hey, my kid is not eating right, or it doesn't seem like he's latching, or something along those lines. This can provide comfort for that as well. Yeah, actually, our home health services is integrating the iPads. We do, and we have had practices of using the iPad to connect families, really more of a social, so that families can see their newborns. We've had that in place. I think, but you're absolutely right. When we think about how to provide responsive, proactive healthcare this may be really the way to do that.
And it may be revolutionary in the way that, like I said, when I get to the doctor's office, I'm kind of tense, right? And if you're communicating constantly with a nurse practitioner or with somebody who's dealing with your health issues, you're going to be more comfortable. You're going to be able to open up more when it comes time to be sitting on the paper and talking to your doctor.
It does save time.
Yeah.
And I think that's your point. Can I spend more time with my doctor if he already knows everything about me? and I'm certain it would facilitate at least the technical information that physicians and care providers do need. So immediately they have a care plan in mind. They've already reviewed it in a way. So that potential is there too. So I think what we're also looking at, what's pretty amazing, what we have in place now is what I would call EICU, the ability for physicians and nurses to actually monitor. They're in the care environment, they're next to the patient's side, but if they're not standing literally over the bedside watching that patient. But if there's any deterioration in a patient's condition, there's actually e-monitoring going on, an algorithm of sorts that monitors your weight, blood pressure, heart rate, oxygen, for appropriate rhythms of the heart. Any symptoms that show fluctuation or deterioration automatically signal the nurse in this case, to check on the patient. And it pages the nurse, and the nurse immediately responds, and intervenes as necessary, contacts the physician. So it's pretty remarkable what can be accomplished when we apply technology.
This is exciting stuff. We're speaking with Associate Administrator Heidi Lenartz of Providence Holy Cross. We're actually going to take a quick break. We'll have one more segment with Associate Administrator Heidi Lenartz of Providence Holy Cross. This is the Providence Holy Cross Hour on AM 1220 KHTS. Santa Clarita's hometown station, AM 1220 KHTS. This is the Providence Holy Cross Hour. Learn more at providence.org/Holy Cross. We're speaking with Associate Administrator Heidi Lenartz over from Providence Holy Cross. And again, we're streaming live at hometownstation.com. Make sure you like us on Facebook and follow us on Twitter today. And we've been talking about really the future and how the future is today. Telehealth and telemedicine, explaining what that is and the different programs that are offered with telemedicine and telehealth through Providence Holy Cross. And it really makes things more efficient for both the patients and the doctors. Doctors are able to see more patients, and patients are able to find out more information about their current health concerns right away.
Yeah, absolutely, and that's all wonderful.
Yeah.
And I think in the quality arena, we're able to identify high-risk patients and identify potential deteriorations. All that is really, really well, and we're able to meet the patient where the patient lives. But I'm mindful when I'm talking with you, Kyle, that nothing can really replace that relationship that the physician has with the patient and that the patient has with their care provider, the physician, the nurse. I mean, these are such important relationships. And that does also have to be in person. I think what's most striking about Providence Holy Cross Medical Center is that ability for our care team to really, on a personal and right there with you basis, really bring that relationship and pull that patient tightly into the care of the team. And I think people feel that at Providence Holy Cross. So I also like to think of telemedicine as only improving on that already existing relationship. Yes, it's in an urgent, emergent situation. It saves lives. It can save lives, and that's really how I believe it started. But on an ongoing inpatient or after you're in the hospital, it can really extend that wonderful relationship that you have with your care team and your physician and your physician's office into the community and to your home and to your family. And that's where I think the opportunity is in the future. How are we building in an optimal optimal and coordinated kind of care environment after a person leaves the hospital. Some of that has to be more intensive, really monitoring vital signs from at home and remotely. And others can be check-in and preventive. So I'm mindful that the relationship really does start with the physician and the physician's, team and inpatient and outpatient. I think that the quality aspects of what telehealth and telemedicine offer really are only going to enhance that relationship.
I think, the goal of telehealth and telemedicine is not to make doctors not have to come to work.
No, they will, I believe, a lot of job security there.
Yeah,
Yes.
certainly. I actually wanted to ask you, I don't think I asked you this, but you seem like prior to coming to Providence Holy Cross, you had a lot of experience in your field. What stuck out to you about Providence that made you want to join the team?
I was at a nearby hospital as an administrator and worked with and collaborated with Providence Holy Cross in many different ways, and was always impressed and aware of how mindful and respectful and responsive Providence Holy Cross was to both our hospital as a neighboring hospital, as maybe as a competitor even.
Okay, yeah.
That they were just really always very collaborative and willing to help, willing to serve. And everyone I came in contact with at Providence Holy Cross was professional, heartfelt, and really believed in the mission of what Providence Holy Cross is there for, which is to help people in need and serve the poor and the vulnerable. And I think that's what I really came to witness as I came to work there. So it's been a wonderful experience, both from all of our services, inpatient, trauma, emergency department services, acute rehab, subacute, obstetrics. We have very busy labor and delivery. And
it's going to get busier, too.
And it's going to get busier with your family, right? And then really more looking at healthcare for Providence Health Services across the region, really collaborating with our own partners in Burbank and in Tarzana to really focus on specialty services so we can reach a broader network of people.
Yeah, and I can attest. My son got a staph infection, so we had to take him to Providence, and the care at Providence is second to none. In all luckily I haven't made a ton of hospital visits, but or ER visits for that matter. But it was the nursing staff especially was so comforting for people with a brand new 15-month-old kid for the first time, having to take him to the hospital and stuff. And it was wonderful care over there at Providence Holy Cross. And we only have about a minute here, but do you see telehealth? Obviously, the future is today; it's happening already. But are you like excited about this? About the future of medicine and telehealth and telemedicine?
Very excited about it. I really see this as the one opportunity among many that can improve the quality of life for people. We think about a generation of computer users who are now blooming,
yes.
Or they're growing up with computers and iPads and Fitbits, and think about the possibilities that these people and these young folk will bring to transforming healthcare and medicine, both as care providers as they become doctors. What their vision's going to be. I mean, we're just on the precipice of major transformation in terms of telemedicine, and I think this is the future. And what I said to you, Kyle, the future is now.
Yeah, the future is now.
It's really starting now. So.
Yeah. Thank you so much, Heidi. Heidi Lenartz joined us. She's the Associate Administrator from Providence Holy Cross. This has been the Providence Holy Cross Hour. Again, thank you for coming by. This was really interesting stuff, and my mind was blown here with robots and all that stuff.
Thank you for having me.
Yeah, thank you. Heidi Lenartz, Associate Administrator at Providence Holy Cross. Learn more at providence.org/Holy Holy Cross. That does it for me, Kyle Jellings. For Heidi Lenartz, this has been the Providence Holy Cross Hour on AM 1220 KHTS.